I founded Beat AIDS Project Zimbabwe, and BEAT stands for Bringing Education, Advocacy, and Treatment for AIDS to Zimbabwe. So it's Beat AIDS Project Zimbabwe. And it's sort of a branch off of what we've been doing in the United States as an HIV specialist since 1987. So we realized that Victoria Falls, we're in the highest prevalence area for HIV in the country, possibly in the world, and that we needed to really get some services out there to help the Ministry of Health. So we're sort of filling all the capacity gaps and working in partnership with the Ministry of Health with our Memorandum of Understanding and our PVO, our Private Volunteer Organization status, and we're doing full service comprehensive care. We've reached out to the community since we've been here. We've been here for about 4 years, and we chose to really partner with the Ministry of Health before we decided to build any kind of infrastructure. So the community knows us because we've been working with them and doing HIV testing and counseling with them for many years now. We also do outreach to 53 rural villages in 12 different rural health centers along with the Ministry of Health. And it finally came to the point now that we're all set and people know us, that we built a state-of-the-art HIV sort of specialty center, a clinic in the high-density area of Mikasana in Victoria Falls. And in this clinic, of course, we do everything from HIV testing and counseling to state-of-the-art TB and multi-drug resistant TB screening. We are the only center west of Harare doing adult viral load analysis now, and we just opened June 18th. We're certainly doing early infant detection, which is much needed service at this point. So if there's any service that you could think of that people HIV positive need, we do that. Plus we have the specialists that certainly come in and help out with all the specialty type problems. Our eventual goal is to bring over a lot of the US and European specialists to help fill some of those gaps and let them spend 2 weeks, 4 weeks over here working at the hospital, working at the clinic, going on outreach and doing full service. We created that campaign knowing that there's so much stigma that still exists, like in the United States, no different than here in Zimbabwe. And we know that 11.8% of men have been tested in this country, which is very, very low. So we've created an anti-stigma campaign known as HIV Equal. Essentially, we throw an event, go out to do outreach, we have a testing event. The key is, if you want to get these beautiful HIV Equal photographs that says everybody has an HIV status, we are all HIV equal, and you don't have to be HIV positive to test and show that you're against stigma and get these photos done, you must get tested first. We then photograph you, we hand you the photo, and then you get a beautiful HIV Equal t-shirt. It's a black t-shirt with sort of magenta HIV Equal on it, and people can wear that as clothing around town, and it shows that you are fighting HIV stigma. So there is that whole stigma. Everybody is worried about what their neighbors will think, what their wives will think, what their families will think, and all that bit. And we've just trying to counsel people to understand that everybody in Zimbabwe knows somebody who's been sick or has died from HIV. That, we try to overcome that stigma just by talking and educating and letting people know that just like in the United States and elsewhere around the world, you now can treat HIV. We are actually planning with the district medical officer and the rural district to come back here on the September 20th through 24th and focus specifically on children and adolescents. We hope to have a 4-day testing event in the rural villages, and my goal is, can we test 1,500 children and adolescents? We've already been testing children and adolescents when we do our HIV Equal campaigns, but let's do a campaign where we specifically focus on children and adolescents. Education, of course, included, testing, counseling, of course, included, as well as all the photographs that we can then hand out to the children, their families, that pass these photos down through the generations, they show their neighbors, they wear their t-shirts. It keeps promoting and it keeps propagating anti-stigma. I was delighted to be invited to be on the scientific committee of ICASA, so it was wonderful. I met the chairperson of SAA in Vancouver, and we were just talking about what we were doing in Victoria Falls. Little did I know that he had actually come to Victoria Falls to see our specialty clinic, and so they invited me into the conference to do some scientific abstract review and spend the day here, organizing the conference, and I was honored to be able to do so. I have a very big background in doing my own clinical research in the United States, having done over 120 clinical trials and stuff. I'm not necessarily about clinical trials here in Zimbabwe, but I certainly know these things and I can contribute all my expertise to a conference like this. This is very important to bring this conference to Zimbabwe.